It's good to see so many people joining this webinar today. We'll give it a few extra minutes for people to log on and become live. But we will start in less than a minute's time from now. It's always good to start on time. Those who've joined a little late will obviously be able to catch up. But I'll be giving some preamble anyway, so I don't think anybody who joins a couple of minutes late will miss any of the critical bits, which of course are the presentations and then the discussion that will follow. So having said that, it's probably a good time to start. So firstly, good morning, officially good morning to everyone. Just to introduce myself, I'm Pete Borriello. I'm chair of RUMA's Independent Scientific Group. So I'm chairing this webinar in that capacity. And it's a great pleasure to welcome you to this fourth webinar. It's the fourth of 5 in the RUMA Agri Conference series. And this is one about environmental aspects of AMR, which of course is complex and increasingly of interest. So just a little bit of housekeeping. The format of this webinar, for those who haven't been on the series so far, is that you will be mute and invisible. No apologies for that. This is so the speakers get all the screen time. But more importantly, there is across the top, you'll see across the top of your screen, a Q&A function. Now, this permits people to pose questions throughout the presentations, which means that the team can help collate those, and we'll then be picking up those questions at the end of both presentations, not after each individual one. So you'll have to wait till the end, and then hopefully we'll have quite an active discussion. So please do pose your questions, and that question function is open continually right up to the very end. So that's the format. Just a little bit of background before I introduce the speakers. I mean, firstly, it's with great pride, and it should be with great pride, that the RUMA and the UK in general has reduced antibiotic use in livestock by just under 60%, 59% over the last 9 years. And just as importantly, maybe more importantly, the reduction in the so-called high priority critically important antibiotics reduced 82%, which is a phenomenal achievement, and has been recognised by the FAO, who've used the UK voluntary approach as a case study. So lots of plaudits there. But that doesn't mean there's not more to do. So the reduction of use, of course, reduces the amount that potentially can get into the environment. But we're now at the position where there's increasing interest of the impact of what can get into the environment, and it's exceptionally complex. So RUMA is keen to be on the front foot here and taking a keen interest in this. And this webinar is part of that interest and part of that engagement. It's a key step in the process of looking at this very complex issue. And to help explore that, we have some key speakers today. The first presentation will come from Francine Fernandez, who's a senior environmental safety assessor at the Veterinary Medicines Directorate, supported by Gavin Hall, who's the deputy chief executive of the Veterinary Medicines Directorate, who is also director of authorizations. So it's great that they're able to make the time to join us today and to have such two powerful hitters to join us on this webinar. And that's followed by Laura Higham, who's been commissioned by RUMA to look into this complex area. And her presentation today, which follows the other one, will be what is known in this area, what's the evidence, what are the evidence gaps, which this webinar will help also to help finalize, so that RUMA can start then looking sometime next year to complete the report, to look into where RUMA and other key players might be able to make some interventions to help reduce any adverse impacts. So having said that, hopefully having set the scene, I'm going to hand over I think Francine's starting, or are you introducing, Gavin? No, so it's directly over to Francine. So the floor is yours. Thank you.
Okay, thank you very much. I'm just going to go ahead and share my screen. So can everybody see my screen? Yeah, okay. So Pete has already very politely introduced me. I'm Francine Fernandez, and I'm the Senior Environmental Safety Assessor at the Veterinary Medicines Directorate. And today, what I'm going to attempt is to explain the process for assessing risk to the environment during the authorization of a veterinary medicine. And I do apologize in advance. It's a bit dry. It's challenging to explain regulations in any other way. However, this is quite important and useful, so hopefully you will find it useful. So what is an environmental risk assessment for veterinary medicines? In the context of the current regulatory framework, it can be defined as the process of predicting the likelihood of a substance to cause harmful effects to the wider environment based on estimated exposure. And this slide shows a generalized model of risk assessment to further define the process. And as you can see, there's 3 elements to consider. So estimated environmental exposure is based on pattern of use, concentration of the substance entering the environment, and fate, so how the substance behaves in the environment. And then harmful effects, which identify hazards associated with the substance in question, are determined by carrying out standardized ecotoxicity tests. Finally, comparing the estimated exposure to the identified hazard gives an indication of the potential risks to the environment following use. So that's the general concept behind environmental risk assessment. Going into some specifics, current UK regulations require that environmental risk assessments are carried out as part of the authorization process for all new veterinary medicines, regardless of whether they're generic or originator products. However, this will be changing in the new regulations so that environmental risk assessments will no longer be routinely required in support of applications for generic products, although there are a number of criteria that will need to be met for this exemption to apply. Some general points now. Environmental risk assessments adhere to international cooperation on harmonization of technical requirements for registration of veterinary medicinal products, or VICH, guidelines number 6 and number 38. And it should be noted that the assessment is generally carried out on the active substance only. In addition, environmental risk assessments are based on a total residue approach, which means that in the first instance, it's assumed that the entire quantity of the active substance that's used to treat the animal will also enter the environment. This is considered to be a worst case scenario and therefore a protective approach. Finally, environmental risk assessments are broken down into 2 phases. Phase 1 is a relatively straightforward exposure assessment that is largely a paper exercise, while phase 2 is a formal risk assessment. So this slide shows a picture of the decision tree used in phase 1. And you can't see the questions, but it does give, well, maybe you can, I don't know, but it gives an idea of the process. Essentially, a number of questions are asked to determine whether exposure to the environment is likely to be low. And the assumption is made that veterinary medicines with limited use or limited environmental exposure also result in limited environmental effects. If this exposure assessment suggests significant exposure of the environment, then the assessment carries on to phase 2. So the purpose of phase 2 is to assess the potential for a product to affect non-target species in the environment, including both aquatic and terrestrial species. Importantly, a tiered approach is taken at phase 2. The first tier, known as Tier A, uses relatively simple studies to produce a conservative assessment of risk based on exposure and effects in the environment. And it's worth noting that all of the studies are in line with Organization for Economic Cooperation and Development guidelines. So the results from the studies on chemical properties and environmental fate are used to calculate predicted environmental concentrations, or PECs, in the terrestrial and aquatic environment. And the results from the toxicity studies are used to calculate predicted no-effect concentrations, which are also referred to as PNECs. And finally, by comparing the PECs with the PNECs, it's possible to determine whether there's an identified risk. So if an unacceptable risk is highlighted at Tier A, then more studies can be submitted at Tier B. And these studies are often more complex. Some examples include metabolism studies, which can be used to refine exposure, or chronic toxicity studies, which can be used to refine effects. And risk mitigation measures are then agreed based on the outcome of this risk assessment. And they should aim to mitigate exposure, and they need to be demonstrated as effective and also practical and in accordance with good agricultural practice. So that leads quite nicely to some of the key challenges around environmental risk assessment. Firstly, there can be situations where practical risk mitigation measures are not feasible. And in these cases, the identified risks to the environment need to be weighed against the benefits of the product as part of the overall risk-benefit analysis, which is used to determine whether a proposed medicine should be authorized or not. The benefit risk assessment compares the overall health benefits of a medicine to the target animal against the identified risks, not only to the environment, but also to the user and the consumer. And ultimately, this is dealt with on a case-by-case basis, but it is worth noting that applications have been refused based on concerns for environmental safety. Another key challenge I wanted to quickly touch on was identifying products that are persistent, bioaccumulative, and toxic, also known as PBT substances. These are a particular concern for the environment because their combined effects can result in potentially long-term risks. Also, the classic risk characterization model that I just summarized for you is harder to apply in these cases. So to address this, an additional hazard characterization is required for substances where data provided in Tier A suggests that the substance might be PBT. And again, situations where these properties are identified are dealt with on a case-by-case basis and depend on the available evidence and the overall risk-benefit analysis. So, I mean, that is a very quick tour of environmental risk assessments. I also wanted to touch on antimicrobial resistance and environmental safety. So there's a growing body of work demonstrating that the use of antibiotics in veterinary and human medicine contribute to exposure of the environment from antimicrobials, as well as environmental reservoirs of antimicrobial resistant bacteria or antimicrobial resistant genes, facilitating the transfer of mobile genetic elements, either directly or indirectly, to humans and animals. It's important to note here that there's difficulty in identifying the specific source of antimicrobial resistant bacteria or antimicrobial resistant genes. And this is because equivalent compounds exist between human and veterinary medicines. Therefore, it's problematic to attribute a single route as the major source of contamination, and in particular, to disentangle the input from human versus veterinary antimicrobials. It's also worth noting that the European Medicines Agency have drafted a reflection paper on antimicrobial resistance in the environment that aims to consider how antimicrobial resistance and antimicrobial resistant genes might impact the wider environment. So, given the current state of knowledge, essentially the paper concludes that the environmental risk assessment process for veterinary medicinal products cannot be amended yet to consider the risks posed by accumulation of antimicrobial resistant bacteria and genes in the environment. And this is largely due to several evidence gaps that first need to be addressed. However, we should continue to explore the development of improved or alternative risk assessment methodologies with the support of other scientific agencies and bodies to assess if improvements can be made. And some particular areas for consideration are noted here. So firstly, a One Health approach should be taken to minimizing environmental contamination. The World Health Organization's Global Action Plan on AMR included the environment as part of the One Health approach, and the development of strategies to minimize environmental contamination by antimicrobials and resistant bacteria is one of the priorities of One Health. Therefore, any future measures taken to address AMR in the environment should adhere to this approach, where the reduction is not limited to one regulatory arena and all relevant sources are reduced as much as possible. In terms of future assessment for environment for the risk for the environment from antimicrobials, in line with the EMA paper, what's really needed in this area is research. So we should continue to monitor for new data, new approaches and technologies that could be used to improve the current risk assessment process. And I've included some examples here. So for example, the emerging area of using minimal selective concentrations to determine risk posed by AMR, understanding the fate of antimicrobial resistant genes in manure, together with the fate of antibiotics, and ultimately building expertise in the regulatory agencies on approaches to evaluating AMR risks in the environment. And then lastly, I just wanted to highlight some clear quick wins in terms of reducing risk. Particularly, risk management measures can be applied in general to limit environmental exposure, and also promoting prudent use and stewardship of antimicrobials will also reduce the environmental footprint. So I hope you found that informative, and I will stop sharing now. Thank you so much for your time.
Thank you. It was informative and very well presented in clear PowerPoint. So thank you for that. I think unless Gavin's got anything to add at this stage, we can move, and it segues very nicely, of course, directly to Laura's presentation. Laura, floor is yours.
Thanks, Pete. I'm just going to assume that you can see my slide there. Great, thank you very much. I'm delighted to be here today to present on this topic. And as Pete mentioned, my name's Laura Hyam. I'm a veterinary consultant at FAI, the Food Animal Initiative. And following from Francine's presentation, I'll be looking at the situation after antibiotics have been deemed suitable for marketing authorization and the things that we can be aware of as responsible end users of antibiotics to further reduce their environmental footprint. So over the next 20 minutes or so, I will be grappling with my slides, no doubt, but I'll be talking about the background to this issue of antibiotics in the environment. I'll give a brief overview of how we undertook this desk-based assignment on behalf of RUMA before going into more detail on the pathways of both antibiotic compounds and antimicrobial resistance determinants from their source to the various environmental compartments in which they've been discovered. We'll then be reviewing the ecological impact of these entities on entry into the environment before opening up the floor to Q&A. So I don't think we need to dwell too much on this first slide. I think we've got a very technical and scientific audience, so I definitely don't want to patronise you all, but I think it's good to start off on the same page with this issue. Antibiotics have been used in their various forms by human civilization for centuries, and modern medicine has been defined to a large extent by the commercialization of various antibiotic compounds from the 1920s. However, even back then, it was known very well that their use would foster antimicrobial resistance, and subsequently AMR is now considered amongst the most significant health challenges facing human civilization, with antibiotic use in animals acknowledged as a contributing factor. That said, significant reductions, as Pete said before, significant reductions in use have been achieved across many animal sectors in the UK in recent years, evidenced by this year's Task Force Targets report and the VARS report recently published and recently discussed in the first webinar of this series. Antimicrobial use is, of course, the human source of antibiotics and resistance genes in the environment, with repercussions on humans, animals and ecosystems, as we'll soon discover. Therefore, it's very much the quintessential One Health challenge. And with the mounting biodiversity crisis, we have a social responsibility and an opportunity to mitigate the impact of our antibiotic use in the agricultural sector. So in this vein, RUMA commissioned a narrative desk review by FAI to synthesise the existing evidence base around the environmental impact of antibiotic use in terrestrial food-producing animals this year. The scope has been limited to antibiotics, excluding other veterinary medicine categories such as anthelmintics and non-steroidal anti-inflammatories, and we're limiting this to terrestrial species, excluding aquaculture in this instance. We're also interested in the impact of the antibiotics themselves. We're not including the impacts of the production processes, the logistics, the transport, i.e. we're not conducting a life cycle analysis in this particular project. We're also focusing on the impact in UK settings, but of course drawing from the international literature base. And finally, this is a non-systematic review. We take a One Health approach, including human and animal healthcare uses of antibiotics, many of which are shared class, and for reasons that we'll discuss, many of them often arrive into the same environmental compartments. So it's pertinent to apply the One Health approach in this project. So let's get going with the pathways, starting with the pathway that antibiotics take along the value chain. Antibiotics, as I'm sure you know, are absolutely everywhere. Of course, many antibiotics were discovered initially from soil sources. However, human-derived antibiotics are now the major contributor to environmental antibiotics, with the highest concentrations detected in the vicinity of and downstream from sites of human activity, such as hospitals, antibiotic manufacturing sites and farming. The pathway they take from their source, i.e. from the pharmaceutical production sites to the environmental compartments of soil and water, involve multiple steps and stakeholders along the way. And these sources, flows, steps and stakeholders are illustrated in this diagram, which aims to depict the two-way traffic or the circulation of antibiotics and resistance determinants between people, animals and the environment, and the complexities that come with that. And it also identifies multiple nodes of human intervention to mitigate some of these pathways along each path. So we're going to start by sort of paddling upstream to where anthropogenic antibiotics are produced. And of course, that would be pharmaceutical manufacturing facilities. The literature provides examples of antibiotics detected in wastewater effluent draining from these locations. Therefore, these sites can represent point sources of potential environmental antibiotics. Although the literature doesn't actually include much in the way from sort of UK manufacturing, it does include sampling results from pharmaceutical manufacturing centres in India and China, where half of the world's medicines are produced. Pharmaceutical production plants are considered actually to be a small contributor in terms of the total loads of antibiotics discovered in the environment, but local levels can be high. For example, in village wells located downstream from production plants in India, a quinolone was detected at high levels of around 1 microgram per litre, with potential impacts on those human populations. These risks are acknowledged by the pharmaceutical industry, and the AMR Industry Alliance has created a manufacturing standard, a roadmap and effluent targets with water testing campaigns, which is fantastic. And the results of these sampling surveys have been promising. But what currently does remain unclear is the extent of antibiotic discharge from third-party manufacturing sites, many of which are overseas, and the impact of those discharges on people and ecosystems within their watersheds. And of course, these may be part of the UK's human and animal health footprint, and currently, therefore, this represents an important research gap. So moving down the supply chain now, antibiotics are, of course, sold to distributors, wholesalers, healthcare and veterinary providers before being dispensed to patients and animal keepers. There is a theoretical risk of antibiotic environmental discharge via the disposal of unused, unsold, damaged products in the supply chain, but there is no evidence of this in the literature, which hopefully means there is a minimal risk addressed by an effective regulatory environment and very clear guidelines implemented at the level of those stakeholders as to how those drugs should be disposed of. However, the story does change once the antibiotics reach the hands of the end users. Human pharmacies have an obligation to offer a take-back scheme here in the UK, but uptake of this service is currently unknown, and evidence suggests that most unused antibiotics at household level are discarded in household waste, which represents a potential route into the environment via landfill leachate, and also some we know is tipped down the toilet or down sinks as well. Many UK veterinary practices also offer a take-back scheme, but once again, the uptake of this service is unknown. But of course, we're in the middle of this year's antibiotic amnesty, which hopefully will reinforce this route of disposal amongst animal owners and veterinary professionals in the UK. On the pharma side, again, drug disposal routes have not been fully characterised, but it is possible that the economic incentives of farming and the formulations of veterinary drugs, for example, in glass vials, boluses, in-feed formulations, etc., may limit injudicious disposal routes such as down the drain routes. And they may be handed back to vets or discarded in regular household waste. But all of this is very speculative at the moment. As I say, we don't have enough evidence from the literature, and this does warrant further investigation. So once antibiotics have reached the end user, and hopefully all, if not most of the antibiotics are consumed by the animal or the human patient, that antibiotic is metabolized. And we know that between 10 and 100% of those antibiotics are excreted via the urine and the feces. Depending on the antibiotic class, its chemical structure and the route of administration too. And in fact, human and animal patient excretion represents the major source of environmental antibiotics. On the human side, this waste, of course, enters household and hospital wastewater effluent, with the hospital effluent representing an uninterrupted point source of antibiotics. On the animal side, relatively high levels of antibiotics can sometimes be found in animal slurry or manure, of course, reflecting the farm history of antibiotic use. Waste is either deposited directly onto the land in outdoor systems, or it's collected in manure or slurry stores before land application. Although the literature is fragmented, there's a growing evidence that outdoor systems, including but not limited to organic certified systems, tend to be associated with lower average antibiotic use than indoor systems. But the other side to this coin is that outdoor systems are associated with direct diffuse discharge of urine and feces onto the land, whereas indoor systems have the opportunity to store and process waste before its application. Indoor systems do also have to be concerned with the risk of waste overflow during flooding events, potentially representing a point source of pollution from slurry stores and manure heaps. And these events are more likely to become more frequent in the future with climate change. So there's lots of factors at play here, but what is clear is that regardless of the system, there are multiple nodes of intervention for both reducing antibiotic usage, but also reducing waste discharge into environmentally sensitive areas. So moving on to waste treatment. On the human side, wastewater facilities receive the waste, and conventional aerobic processes have limited capacity for removing or reducing these residues from the outputs of these plants. Residues do tend to get removed from the effluent water, which is encouraging, of course, and that clean water goes on to be recycled. But the antibiotics and various bacteria and other entities end up in the sewage sludge, the solid fraction, often in high concentrations. Human sludge goes on to be used for energy production, used as agricultural fertiliser, used in construction, believe it or not, and some of it is incinerated. And the use of human sewage sludge as agricultural fertiliser is, of course, a really important mechanism for reducing our reliance on external chemical inputs and supporting a circular nutrient economy in food production. But with sludge being applied to agricultural land, farmers are essentially receiving the antibiotic legacy of human healthcare, and this warrants greater collaboration between the various sectors. On the animal side, manure and slurry collected in indoor systems can be subject to storage, as well as processes such as composting and anaerobic digestion. Although efficiency of these processes in reducing or removing antibiotic residues is variable, composting can remove up to 100% of some antibiotics, probably due to a combination of conditions, including heat, that favour their degradation. However, high concentrations of certain veterinary antibiotics have been detected in UK soils, so some is clearly entering the environmental compartment. So after they've been discharged, how do these compounds behave in the environment? And unfortunately, the answer to this question is highly dependent on the local biological, chemical and physical factors, and also on the antibiotic compound itself. So some antibiotics have a propensity for very rapid degradation, some for sorption, as in attachment or incorporation into solid particles, or motility, which generally means it ends up in the water and flows away. And then some is also subject to photolysis, so it's degraded by light exposure. Many will degrade more quickly in higher temperatures and aerobic environments, and there is a very wide spectrum of persistence amongst antibiotics. Some of these compounds have very short lives, short half-lives of hours to days, but others, for example, certain quinolones, can persist for months to years in manure. So we're going to very briefly look now, so we've covered a lot about sort of antibiotics themselves, the compounds themselves, but we're going to now take a look briefly at the pathways for antimicrobial resistance determinants. And I say quite briefly because the pathways of these entities largely follow those of the antibiotics themselves, because of course the selection pressure that antibiotic compounds apply. Antimicrobial resistance determinants include both resistant bacteria and resistance genes, as Francine also mentioned, and these entities have both natural and human origins. They're found in pristine natural environments, but they've also been amplified and disseminated by human activities that discharge either antibiotics or the resistance determinants themselves, usually via human and animal waste. They've been found in every environmental compartment on Earth, in ground and surface waters, in soils, in the air, and even in the clouds. From farmed animal settings, they're discharged in manure and they can degrade over time. For example, after 90 days without fresh input into a slurry lagoon, cephalosporin-resistant E. coli can largely degrade. Although this isn't always the case, some processing methods such as composting and anaerobic digestion can actually increase levels of antimicrobial resistance depending on the bacteria within it. So the fate of these entities in the environment is highly variable. There's also a role for other pollutants that can be synergistic with antimicrobial resistance. And with microplastics, for example, evidenced as to act as vectors of AMR, and also some heavy metals, herbicides and pesticides identified that can actually foster the development of antimicrobial resistance. So we're nearing the end of this presentation now, and after stepping through the various pathways, we're perhaps wondering, what do these entities actually do? Are they actually a problem? Well, low concentrations of antibiotics can select for antimicrobial resistance, which can alter the resistome and can also exert ecotoxic effects on non-target organisms, as again Francine was talking about. Although antibiotics are not generally toxic to vertebrates and humans positioned high up in the food chain, which of course make them good medicines, they can be toxic to species occupying lower trophic levels, such as cyanobacteria, marine bacteria, and algae that constitute the bedrock of various ecosystems. The toxic concentrations, often quoted as the lethal dose 50 or the predicted no effect concentration, of course, vary very much with the antibiotic, but for some, the concentrations at which they are toxic can be quite low. The impact on various species can have both direct effects, but also indirect, undesirable impacts. For example, although antibiotics don't necessarily impact dung beetle populations, they can alter their microflora to the extent that they can increase methane emissions from dung pats. So antimicrobial resistance determinants can hamper soil microcommunities, as you would expect, but there's less evidence of their impacts further up the food chain. For example, when associated with virulence, do they impact wildlife populations occupying those higher trophic levels? So there's lots of questions at the moment that remain unanswered, and this is an area that certainly warrants further research. So that's all at the moment from the report as it stands at the moment. Further work is yet to be done on the report, but I'd just like to reiterate the main points from this piece of work. So firstly, each antibiotic usage event in people or animals represents an environmental footprint, but the size of that footprint is highly variable. Secondly, there is a significant antibiotic and antimicrobial resistance discharge from human activities, including pharmaceutical manufacturing, hospitals, and some farms, with variable and limited capacity to remove all of those residues through conventional waste treatment processes. Injudicious disposal represents a potential source of discharge, but these pathways have not been characterised for farms and are likely to be low at the level of supply chains and veterinary practices. Excretion by patients represents the main source of or the main route of antibiotics into the environment, and for animals that pathway can either be direct via manure direct onto the land in outdoor systems, or via manure and slurry stores in indoor systems, where some time-based, heat-based and aerobic treatments can be effective in reducing some of that environmental load. And antibiotics and AMR determinants tend to impact species at the bottom of the food web on which our ecosystems depend. And finally, to conclude, it's clear that these routes are possible routes for antibiotics to enter the environment, but it's also important to understand that we consider them and also that we currently can't quantify their impact on antimicrobial resistance development. And that's really important at the moment. It does reveal a large research gap. Current advice still stands, so we should be using medicines responsibly when we need to, and in quantities constituting as little as possible, but as much as necessary in order to protect animal health and welfare. But these findings do add credence and urgency to this position from an environmental and a public health perspective. Thank you very much. Handing back to Pete now.
Thank you. A very clear presentation, particularly of routes and causes of escape into the environment of antibiotics. It's a very complex area. We've started to get a very steady flow of questions. Just before I pick some of those up, to remind people that the Q&A function remains live and it's at the top of your screen, nestled between chat and people. And just to remind people, as I've said many times before, there's no such thing as a stupid question, only stupid answers. So not putting the presenters under any sort of pressure. I suppose we have a mixture of general and quite specific questions. But I suppose one of the first more general ones, probably for Laura, but then also onto Francine and Gavin, which is that, of course, primary interest is in antibacterials, antibiotics, which is where most resistance is. Most infections are due to, particularly in the developed world, are bacterial, both humans and animals. But of course, there are antifungal resistance, antiviral resistance, although that's a little less at the moment, anti-parasiticide resistance, etc. So that whole general resistance, where the focus tends to be on antibacterials, antibiotics. But in two questions, I suppose, one for Laura, which is in your overall review, have you seen much comment about things other than just antibacterials? And Gavin and Francine, I presume the general approach captures all, but maybe a few comments from you on that as well. Laura.
Thank you. Yeah, absolutely. I mean, there's a a variety of veterinary medicine classes that are of potential risk to ecological settings. We know about the risks of non-steroidal anti-inflammatories in certain cases, about hormones, about psychoactive drugs even, or should I say sort of sedatives that are used in veterinary medicine, and also on the human healthcare side of things. So again, psychoactive substances that are detected in ecological settings. That all goes without saying that as well, not antiparasitics. This is a really hot topic, certainly in the medical world, veterinary medical world, but also in agriculture at the moment, and in the pet side of things. A lot of work is being undertaken at the moment with regards to antiparasitics and their impact on aquatic and invertebrate species. So yeah, there's a raft of sort of evidence emerging on that. The focus of this report was very much antibiotics, because this is I'd say it's been emerging over the last 20 years as a key issue of concern to a wide variety of stakeholders, and there is no shortage of literature about the impact in the environment of antibiotics. But with this report, we're really honing in on the UK agricultural sector and how it might have implications for that, and how we can support a responsible use agenda for both the public health but also the environmental side of things. So in short, yeah, there are other substances of concern to the environment, and lots of work is also being undertaken in parallel around those substances. You're muted, Pete. So
having said there's no such thing as stupid, I've just proved everybody that there is, and it's me. Yes, I mean, particularly for antifungals, there's also the issue in horticulture, where there's quite a lot of use of antifungals. I think most of the antifungals probably sit in that area, so there might be a pull across. Francine, Gavin?
Yeah, thanks, Pete. It's probably worth making a couple of points. As you say, antifungals, there are very few antifungals in the veterinary medicines world that we have authorised, but we do have the policy lead for antiparasitic resistance in the Veterinary Medicines Directorate. I think it's true to say that when it's nowhere near as established as the policy units for antimicrobial resistance, so we're kind of playing catch up. But we do have some pan industry groups such as SCOPS, COWS, Cantor, where we're looking at across the piece as responsible use. We're in the process at the moment of looking how we might begin to gather sales data to actually have some metrics by saying, how is responsible use manifesting itself? Is it making a difference? But we're at an early stage of that. But it is something that's recognised, and we talk to our counterparts across those regulatory bodies with which we have fairly regular contact with. So that's in the States, Canada, Australia, New Zealand, Switzerland, and of course, the European member states, as and when politics currently allow.
Thank you. In a similar vein about the environment, of course, as you mentioned in your presentation, Laura, the UN has got this, I think it's environmental group or branch of the UN has now got AMR on its agenda, which it didn't in the past. So now the environment is very much part of one of the planks of the One Health approach, and correctly so. From what you've seen, what do you have anything in mind that you think they should be considering in terms of monitoring recommendations?
Yeah, I think this is a great question. Yeah, the UN is certainly on this issue. One of the sort of catalysts, I suppose, for some of this work in recent times has been the UN's Bracing for Superbugs report that was published early this year on the environmental impacts of antimicrobial resistance and also antibiotics too. So they're very much onto this agenda at the moment. The AMR Industry Alliance is putting in place some good metrics on wastewater effluent downstream from pharmaceutical plants, and I think some of their metrics are quite useful for across the board, looking at environmental compartments, particularly water, and how we are impacting those. And there's a suggested sort of threshold maximum concentration that they're proposing of 0.05 micrograms per litre, that basically talks to the PNEC values of many of the antibiotics, because this is the value that where many of the antibiotics above that value would be considered would be considered unsafe for aquatic and invertebrate species. So some quite nice targets that have already been sort of suggested by particularly the industry bodies. I'd very much defer to VMD on some of this as well. But yeah, basically the concentrations of antibiotics in various environmental compartments. We need to be doing more work to discover the concentrations across the UK in different places. And I think the PNEC values are really important too. So again, the AMR Industry Alliance and no doubt the VMD have got lists of PNEC values established for various antibiotics and various non-target organisms that are very well evidenced, and they're the values that we can turn to.
Yes, thank you. I mean, if I may take Chair's prerogative, just to broaden a little on that, I think one has to bear in mind when talking about surveillance, which is what this question relates to in a way, is that for many parts of the world, the ability to undertake surveillance and how high on its own priority list that differs greatly. So, one could envisage, you must do environmental surveillance, and a lot of countries aren't even able to do clinical surveillance in people, let alone animals, and the environment will probably fall fairly low on the list, both in terms of capability and relative considered value within a country. And I think that's something that probably has to be addressed, which will be difficult but not impossible to address, is to try and show what's the value of undertaking this, which is a slightly different question, and people tend to assume obviously it's obvious to everyone. Well, not always, even at national levels. So I think that's an important consideration. And another one, I think, something that I would flag quite strongly is the risk that people keep reporting things in the environment as resistant when they're actually talking about ecological cutoff values, which in reality is a measure of changes in susceptibility. Most people, when it comes to risk communication, if you say organism Z's now become resistant to antibiotic W, they will assume I can no longer be treated with antibiotic W, and it doesn't mean that at all. For resistance really should be reserved for clinical breakpoint measurements. And I think as we increasingly start monitoring the environment, of which of course we include food, but we're talking general environment now, that distinction I think people should continually push for, because it can become very confusing. A question, if I may, just to relay from what ones we've been receiving, Gavin or Francine, which is on the environmental risk assessments and judgments that you make. It sounded as if it concentrated, of course, on the antibiotic and its residues or potential residues before they're excreted. And the question posed was, well, what about resistance genes, resistant determinants, cassettes of resistance genes, that sort of thing? Are they considered in any way?
So that's an interesting question. I think, if it's okay for me to answer this, Gavin, I think in terms of our environmental risk assessment, we focus on, I wouldn't say residues, but I mentioned the total residue approach. So we assume that the entire dose that you use to treat the animal is entering the environment in the first instance when we look at predicted environmental concentrations. And then we carry out a very classical sort of toxicological risk characterization. We look at, in terms of species that might be relevant to this discussion, we look at like soil nitrogen, bacteria, and we also look at algae. But we don't look at AMR resistant genes. We haven't, we need more research first before we change our risk characterization process, which I think I said in the slides. I hope that answers.
Yes, and I suppose it could be quite difficult in that, first of all, you've got to look at the potential impact of the medicine, in this case, an antibiotic or an antifungal, on the microbiota of the animal. and then the extent to which that will survive, induce any sort of resistance or decrease susceptibility, and then longevity of that in the environment, as well as its potential transferability. It starts to get very, very complex. I've no doubt greater minds than ours will be wrestling with this problem and at some stage coming up with some sort of recommendation. And we also had a question in a related area about quite an interesting one, really, in that basically it's asking, are farmers sufficiently aware in different parts of the world of the potential risk when using human manure, for example, for fertilizer, of the risk of spreading antibiotic resistance genes as well as antibiotic residues onto the land directly from human source? Laura?
Yeah, I mean, I can't speak for all farmers, but my feeling would be that no, there is limited awareness of that, and hopefully this report will sort of highlight some of these complexities and the need for sort of further cross-sectoral working. I think it's important to say too that there are regulations, of course, in the UK and in many countries around how that sewage sludge is treated and how and when it can be applied to the land. For example, there's very clear regulations on the fact it should be drilled at certain times of the year, and it can't be applied to crops post germination, for example. So it's very clear that there are many mitigation measures in place from the Environmental Agency, for example, that will limit direct spreading of that sewage sludge onto crops designed for human usage. Of course, those checks and balances have been covered, but I think less awareness that sludge does contain entities that yes, may degrade over time, but will potentially be present in that sludge for a period of time after spreading. And I think we need more awareness amongst farmers in the agricultural sector around that. What I would not wish to do is to create an environment of fear around using these really valuable nutrient sources. You know, we are looking to develop a sustainable economy in farming and to reduce our environmental footprint and use of, for example, chemical external fertilizers. This certainly should not raise concerns to the extent that we should not be looking towards circular nutrient economy. That's so vital for the future. But I think that it does raise questions about how we work across the sectors, about how we mitigate these risks, and how we potentially simply store sewage sludge and manure for longer periods in order to ensure that it's going through this life cycle and that we're observing the half-lives of these entities before putting it onto the land. So I think there's lots that we can do at the moment, and awareness is really critical. But yeah, in answer to your first question, I don't think farmers are fully aware of this issue.
Yes, and in many cases, the amount that can be spread on the land in developed countries is governed by nitrogen levels, which tends to be the unit that one can use to see how much is generally spread. And the industry complies with that, at least in the developed world. And I just wonder, just as a pull across from that to Gavin and Francine, but particularly Gavin, in that I suppose increasingly there should be closer working at an earlier stage between the environment agencies and medicine regulators, both human and veterinary, do you think, in the future? It tends to be sequential, or one reacting after decisions have been made. I just wondered what your views were on that.
Yeah, thanks, Pete. As you know, that there is international cooperation harmonization guidelines that are developed and we follow. Development of those can take a while, if I'm honest, and maybe too long. But what we have done, and it's actually one of the benefits of COVID, if you can look at it in that way, we've established real close links with other regulators across the globe outside of these harmonization meetings, and we're moving more into collaboration. And that's a tremendous advance, at least in the last 2 or 3 years. We regularly bring together, and we meet with 5 regulators on a monthly basis, issues that are facing us in any one go. And it's the kind of thing we've been talking about from a very early stage. So we've been discussing, for example, methane inhibitors. We've discussed AMR, anthelmintic resistance, all very early stages so that we can actually work together. One of the concepts we're looking at is we all have very limited research and development budgets. So if we have the same problems, and if we pool our money, then there could be greater scope for doing one test in the UK or one set of studies in the UK, research, complementary research in, say, New Zealand. Now, it has to be relevant, but we're having those discussions to see if we can get more bang for our buck. And that, I think that's a good way forward, a very positive way forward. And for me, that's one of the few benefits of COVID, the outcomes of COVID, not least being having virtual meetings that makes this possible too. You're on mute, Pete.
I was interested in that the comment about working closely with others, particularly in this area. How do you think the UK process of doing environmental risk, ecotoxicity, etc., which is still closely aligned, of course, with the EU process, to what extent do you think that compares with what happens in the rest of the world? Because in reality, it's no good one part of the world or one country excelling. It needs everybody to get to a high level. Are these standards in the top tier? Are there others doing some things which probably might be a bit better, or do we just not know?
Yeah, I think I can't speak for the whole of the regulatory world, but the ones that we contact fairly regularly, which as I said is Australia, New Zealand, Canada, America, Switzerland, and the EU member states, and through the EMA as well, they all have signed up to the guidelines that Francine mentioned within her presentation, and they follow those. Now, in New Zealand, for example, they might have other additional national requirements because their land is disease free of certain things, and this is a general point, so they might have additional layer of complexity and assessment, but in principle it's the same. And that's not also true of environmental assessments, but other efficacy assessments and quality assessments. And I think that's an essential way to ensure that we have available medicines as best we can. We all know that it is some of these medicines make very little money and very little profit, and there's an issue with the availability of medicines. So having harmonized procedures that is followed for all of the parties ensure that the companies only have to generate one set of data, one set of studies. They might have to represent it into national and local formats, but they're not repeating studies and not retesting on animals. They're keeping the 3 R's principles at the forefront of their thinking. And so you can reuse data that you've only generated once. And that ensures that you're more likely to get applications for medicines submitted in those major regulatory jurisdictions.
Yes, and I suppose a brief follow-up to that is that the mitigations are undertaken, which is very refined and actually quite demanding work and complex work. But once you've got those risk mitigations, how are they communicated to the user? Because if they don't abide by them, then to a certain extent, that hard work is a little bit of a waste of time in some ways. So. And we've already heard about, the voluntary disposal scheme because people don't dispose of their things properly, but even during use, even by professionals, how is that best communicated, do you think?
Yeah, I think it's just to, again, take a little bit of a prerogative just to expand on the answer. Veterinary medicines, like human medicines, are not 100% safe. And during our assessment, as Francine's alluded to, whether it's environment, whether it's user safety, whether it's target safety and to the animal, we consider the benefits of using that particular product. And if they outweigh the risks, then they're granted an authorization. Now, we use quite a lot of mitigation to minimize the impact of those risks. And then that could be very simply, it's required to be prescribed by veterinary surgeons. You get point of sale advice. It could be that if the risk profile is very safe, then it might be over the counter. We do things like childproof closures to ensure that the exposure to family members is appropriate. We might limit pack sizes so that there's not a disproportionate amount of product around. But by and large, the mitigations are written on the summary product characteristics and also the outer packaging or the package leaflet of the particular product. and it's essential that they're followed because they are the mitigations to prevent that risk. Now, clearly, if they're ignored, then that could result in an unintended consequence. But I think the take-home message is, if you have a medicine, whether it's human or veterinary, read the package leaflet, read the box, read the summary product characteristics, and follow the advice, either from the point of sale from a veterinary professional or specially qualified person, or from a pharmacist, or what's on the box.
Yes, good point. Again, it's making it a habit and part of the culture, isn't it? Which I think is where these sorts of things and lots of other work around the world is raising the whole awareness, helps to breed that culture of paying attention to doing the right thing at every stage. A few related questions which are coming in are about integrated surveillance and you know, instead of compartmentalized, how do we bring all this together and what's happening? Just before I hand over, I mean, certainly there's a major program in the UK for integrated surveillance platform, which is being led by the Food Standards Agency, which is cross-government, which will be bringing human, veterinary and food data together in one place. There's a lot of work happening there, and there was a major investment by the government to enable that to happen. I see a lot of reports which are called One Health reports on surveillance, but in reality they're just individual reports put between the same covers. There's no analysis or even ability to do integrated analysis, so I don't find those a bit of a smokescreen, to be honest. But there are moves available in the UK. I'm not sure the extent to which environmental data can be brought in. I'm pretty sure the FSA one is going to be considering that. I know they got some environmental microbiologists with an interest in AMR involved in that. But do any of the speakers have any views on other integrated surveillance reports I may be aware of, or how we should start to approach this? I've already made one comment about the definition of resistance, for example. So I may have been a bad chairman and answered the question.
Well, I think all I would say, Pete, is being joined up as a principle is a good thing across governments, across government and across territories and governments. We're all facing the same issues, and this is a very general, high principled answer. But we are finding, as I said earlier, that the issues we're facing here are very similar issues being faced by other regulators, other governments. And it's not always straightforward because different departments deal with different elements. So if we were to speak to someone, for example, about AMR, we have to go to a different department in Canada, for example, as we would if we were speaking about an anthelmintic. So there is some challenges in getting and linking up to the right department. But I think the links are forging, and it's essential that we do that. We all learn from each other. We've all got limited resource, and there's no point reinventing the wheel. And if someone's got a solution, then we should be using it.
Yeah, no, absolutely. And I think, I mean, it's a critical question, and the integrated surveillance. I mean, it relates to that broader question of data availability, its integration, asking the right questions and presenting the outcomes in the right way. And my own vision of integrated surveillance is that it has to be interrogatable. People have to be able to go in and do their own interrogation. You know, all public bodies really are custodians of data. They're not owners of it. And it should be that those cruder data, the original data, should be made available so that others can interrogate and do their own analysis. They may have a smarter way, they may have a different question, which is not quite the same as making available the public sector's analysis of those data and presenting the analysed data. So for anything on MICs, you know, they should show the full range. People should be able to go in and make their own determination. So that's one of my own personal views on integrated data, is that it should be able to be interrogated, but also in a non-interrogation of basic data, people should be able to ask a simple question. You know, how often has this serotype, serogroup, or this resistance determinant been detected in food between whatever? And it should just come up. Now, if AI can't be applied to that, I don't know where it could be applied. It should just get a pie chart, something that's easy to understand. So I think those sorts of things would be my own vision. But I don't think we should underestimate how difficult it may be, because it surprises a lot of people. But from a pragmatic point of view, I recall when we were looking at Campylobacter as a foodborne pathogen, trying to do a One Health report. Most clinical labs won't report the species. They don't use the same antibiotic panels. There's certainly a lack of commonality between the clinical and the veterinary. You've got some people doing environmental cutoff values when they're looking at Campylobacter in the environment, as it might enter a chicken or not. And then you've got clinical breakpoints being reported and done in the clinical lab. So you can't get, they don't show the data, they just say it was resistant, indeterminate, susceptible. You get people using disk diffusion instead of MICs. They're using different methodology. They're not all part of accreditation schemes. They can't have equal assurance about the quality of the data. There's some real fundamental basics that have to be put right first, because it's that old age adage, isn't it? That rubbish in, rubbish out. And so that quality control at the front end, where I'd rather see fewer data, but data you can have more confidence in, than general sweeping. You know, everybody can submit everything, like sweeping up, I think is problematic. So anyway, Chairman's prerogative, that's my vision of what integrated surveillance should be. If we achieve it, I don't know, but it's a start. One other question I have is about the potential date of publication from anything, from Laura, for example, so that I know your presentation is concentrated quite correctly on, you know, these are the issues. Hopefully this webinar and some of the questions will now be feeding into that wealth of information that you're trawling through. And actually, while we've got so many bright people on the line, if they come across anything that relates to some of these questions, I think it would be useful to feed it in to RUMA at some stage, so that we can be aware of it and use it. But Laura, any timescales on anything that might come out of this?
Yeah, it's just a case of a wait and see at the moment, I'm afraid. So the project is still very much live and ongoing, but we do hope to publish something in the new year, basically.
Oh, excellent.
Yeah.
And in saying we'd like comment from people, I've just had one that confirms PathSafe, which is the UK FSA-led integrated surveillance, will have an environmental component, as I thought it would. So it's nice to have that confirmation. Thank you. And they also made the point that the WHO tricycle approach provides a good model for AMR surveillance across governments. So I suspect that's true, and that PathSafe is true. But equally, I know many other countries are looking at integrated surveillance. And as Gavin said, the importance of people with a common interest talking to each other and learning from each other at the front end, as opposed to afterwards, is quite important. I think it's doubly important on what integrated surveillance platforms could or should look like, particularly as one can envision in the future they feed into each other so we can get a better global picture. Is there any comment, not that we're running out of questions, but is there any comment from the speakers? I mean, people rarely ask if the speakers got a question of each other, but did anything strike you as exciting or wow, I didn't understand that? No,
I don't,
Francine.
I mean, yeah, I don't really have any questions, but I do think that Laura's presentation shows that we are going in the right direction, and obviously collaborating and working to solve these issues together is going to be needed. And I just really appreciated that.
Yes, and somebody on the webinars made the comment about the potential or the scope to use the IPCC model as a way of gathering evidence, interrogating evidence, and presenting messages so that they can inform government and then translate into policy. It is a good model. I think it's been damaged by certain controversies, and again, a personal view, I think people involved in these committees shouldn't use them, including the scientists who provide data, shouldn't be fearful of how accurate data might be misinterpreted by those whose views they disagree with, and then try to massage the data or the message. It should always remain fully open and honest. Otherwise, those providing those honest data and views end up being compromised and lose some sort of credibility. We did see that a little bit. So I think there are some lessons to be learned from that, including that one. But any views from others on the sort of models that could be used to help inform government? Having surveillance is one thing, but how you pull that evidence through and start to put it on the agenda of governments so it translates into policy. Laura?
That's a really tricky one. It's a big question there, Pete. Yeah, difficult. I am definitely not a civil servant, nor have worked in sort of policy making processes at government level, and I absolutely take my hat off to those that do, and managing to pull together so many stakeholder viewpoints into sort of robust regulatory approaches. I think it's very, very difficult. But I do think we just need more cross-cutting work streams that work across multiple departments, that work with the private and the public sector, and NGO bodies as well, who have got a lot to contribute to these issues. And I think looking at whole system approaches is just so critical. You know, across my research, there's just so many examples of win-win situations of maintaining a healthy ecosystem. The dung beetle example is one of them, where you know we're absolutely fixed on reducing our climate emissions within the agriculture sector. Lots of targets and work and progress has been made, but we do need to continue that. And we know that some of the ecosystem engineers that help us to do that are some of the invertebrates that, you know, some of which are impacted by novel entities like antibiotics in the environment. So there are win-win opportunities for protecting and preserving those species. Another great example is the earthworm, which can actually help to break down ciprofloxacin and mineralize ciprofloxacin in soils. So the more of those earthworms we have, the more of those dung beetles we have, the more win-win outcomes we're going to see. And it all hinges around, again, responsible, reduced where necessary use of antibiotics. That's the same message as it's always been. But I do think this adds credence and urgency to that message, that this is a circular system. You know, everything impacts everything else. So my only policy sort of to Penneth would be, let's look at it as a systems approach, really. So yeah, fascinating and loads of work to be done for sure.
Yes, and I think an interesting lesson for me in my past involvement in things and policy was the importance of the O'Neill report, which was really saying, if you want governments to listen, however important you think something is, you've got to show the economics and the financial cost, and show that there is an investment and an investment gain potential, which in the end is also how IPCC, the climate change issues started to get traction in parallel with the, look what you're doing to other life forms. So again, how that can be converted to, here's the economics of the contamination of the environment with various things. And there are some lessons that could be drawn from that potentially. We have another question that relates, this is probably one for Gavin, it relates to the drawing on your point, Gavin, about linking with other regulators, and the obvious question, well, now the UK is no longer in the EU, to what extent do we still have any engagement or any input to their considerations, in particular, for example, the EU concept paper on the environmental risk assessments for parasiticides? And then related to that, what about VICH, and do we still have a seat there or not? And I know that's a good news story, but I'll leave you to get that one, Gavin. So two questions there.
Yeah, dealing with the second one first, if I can. We're a full member of the VICH. We participate very fully in the meetings. In fact, I've just had a team return from the last meeting in Tokyo, which was last week. So we're fully engaged with that process. That includes a number of the working groups as well, where we have rapporteurs for different safety guidelines that are going on. And I know that they were at least having an initial consideration around the environmental aspects and looking at the particularly relating to companion animal nectar parasiticides in the environment and water, surface waters. They've started the very, very, very early stage of considering that, and that's based on the EMA concept paper. The second point was to what extent we contributed to that working paper, and the answer is we had very little direct input to its drafting. But as with anybody else, we're free to comment on the consultation phase of that. And when we're in meetings such as VICH, where the European Medicines Agency representatives are present, we chat with them and talk with them. And I guess that's all I can say in that regard. But yeah, we're involved on the international stage. We're front and center still.
And of course, being a member of VICH means that the UK can automatically be part of or even lead on some of the guideline developments that come out of VICH.
Yeah, we're leading on one of the safety ones. So yeah, it's as that work is shared equally amongst those members, we take our full part.
Okay, well, I think we're coming to a close. I think I'll take the opportunity to wrap up. That doesn't stop people continuing to give thought to this issue, and of course contacting RUMA directly was something that I think is going to be helpful in further pursuing this exceptionally complex area. I know I'll forget at the end, so I'll say it now. So this isn't the end of my wrap up. I'm going to bring it to the start of it. Is really to thank the audience, all the participants, particularly for some of the probing questions, and in particular, of course, to thank the presenters. They were very clear presentations and very clear answers. So thank you for that. I enjoyed it tremendously. And most of the questions that flowed in started with the excellent presentation phrase, and I don't think it was just there out of habit. I think people genuinely meant they enjoyed the presentations. So that's always a very positive thing. And of course, this isn't the last webinar in the series. There is another webinar which is on One Health, a key aspect of which we've been speaking about now, but one could argue environment could have been in the One Health one. Doesn't that prove that environment's not still fully considered as a One Health approach? One could say, well, yes, maybe, but I think the One Health bit might draw on some of this, but it's really, I think, specifically between human and animal medicine. That still tends to be the focus. And people can still book for that. That's next Wednesday. All of the 5 webinars, when they're finished, will be available to view on the RUMA website. So I'm looking forward to looking at some of the ones I've missed. And before we close, I think really just to reassure ourselves as well as others in that entering this foray of asking that key question, not, what are the environmental issues, what should government do and all the rest of it, what are the evidence gaps? It's actually saying, what can RUMA do now based on the available evidence? How can we put a foot forward early into this complex area? Even if it concludes there's little we can do, at least people can explain why at the moment and help contribute to the evidence gaps. And I think RUMA should be applauded for taking this step. And when you consider, again, taking this voluntary approach, this has led to this. Nobody's asked RUMA to do it. So I think that whole ethos and that whole culture It's just proof of that engagement, and proof of what can come out of such voluntary approaches and engagement is shown where I open this whole webinar, which is the massive reduction in use, which we're now starting to see translate into reduced levels of resistance, or to put it another way, increased levels of susceptibility in organisms that derive from livestock, whether they're going into the environment or into food. So part of that environment issue has already been addressed in some ways. So again, to close and to thank everybody, but brilliant, really enjoyed it. Thank you.
Thank you. Bye now.
Bye. Thank you.
Yeah, thanks for me too.